Hello, my name is Jennie Popay. I'm based at Lancaster University and I'm a member of the Liverpool and Lancaster Collaboration for Public Health Research, which is a member of the NIHR School of Public Health Research. I'm also the coordinator for public involvement and engagement in SPHR. And I want to tell you a bit about our strategy for public involvement and engagement and highlight just some of the milestones in our implementation of that strategy. I'm going to be talking mostly about public involvement rather than engagement, by which we mean the research with members of the public as partners, not research on members of the public. So the strategy sets out our vision for public involvement, which is that the school becomes an organisation that does inclusive public involvement in all of our work, and that it ensures that the members of the public that get involved in our work have a real impact, a real influence on our decision making at all levels in all ways. We have done that. Our commitment to public involvement is because we believe by doing that we will be more accountable for the public funds that we have to spend on our research. But equally importantly, because by involving the public as partners, by working equally with the public in all of our work, we will ensure that our research is of most relevance, is most timely. It will increase the uptake of our research by public health practitioners and local policymakers, by community activists and other people involved in public health, delivering public health. And by increasing the uptake, it will increase its impact on the health of the people. So we have three high-level strategic objectives that we want to achieve in implementing our strategy. The first is focused on ensuring that we are an organisation that will establish, sustain and value collaborative, respectful relationships between the members of the public who we work with and the academics who are employed and work in the school. Our second objective is to ensure that we produce high quality opportunities for the public to get involved that have real impact on our research. And we want to ensure that the people who get involved, the public who get involved, reflect the diversity of the population of England, and England is our remit. But we have a particular interest in getting members of groups who are bearing the brunt of social and health inequalities involved in our research. That is, groups whose voices are less often heard in the research arena. And our final objective is to ensure that we learn from our experience of public involvement and the experience of our public partners. Not just about the process of involvement, what works well in terms of involving people, but also about what impact that has right across the research process, from setting our priorities, developing our questions, etc., and mobilizing the knowledge at the end. And critically important, that objective is about making sure that we use the learning to improve the quality of involvement for everybody in the school and that we make it publicly available. So we have a triangular architecture structure to deliver on these objectives. So at one corner we have a strategy group, a strategy implementation group, and on that group we have senior academics from each of the 8 members of the school, and they're responsible for overseeing the delivery of the strategy. In another corner of that triangle, we have an operational group, which is a very diverse membership, again from right across the school. It's got early career researchers, mid-career researchers, postdoctoral research fellows, doctoral fellows, and they're delivering many aspects of the actual strategy. And then the third corner of this triangle, absolutely vital, is our public partners network. We affectionately refer to it as the PAN. And that has three key functions really. One, It's a space for members of the public who get involved in the school to share their experiences and learn from one another. It's an opportunity where people can gain new skills and new knowledge. So it's a training space as well, and development space. And it's also a space where public partners get opportunities to be involved at a strategic level in the school. So all of our public partners, every member of the public in the school is automatically a member of the PAN. And they of course are involved in governance at project level and program level. But what the PAN does is open up opportunities for them to get involved in activities that cross the school, that cross the members of the school. So let me tell you then some of the highlights, some of the things that we're delivering on. And I'll start with the PAN, although the PAN and the operational group and the strategy group are working collaboratively on all of this, and of course with other members of the school. So the PAN has set up 3 subgroups. The first subgroup was a communications subgroup, and they've been working with our communications officer. They started by working to improve the quality and accessibility of the website, particularly the pages around public involvement. And they're now moving on to get involved in other aspects of communications. So helping with our brief summaries of research to make sure they're accessible to the public. And they'll be involved in other aspects of our communications policy. The second group that was set up was a governance subgroup. And as I say, members of the public are involved in governance at project and program level, but this group is about getting involved in strategic governance of the schools. So we now have public partners who are contributing to the executive, to the SPHR executive group, which is the key decision-making group in the school. They're contributing to the advisory group. We've actually always had public members on the advisory group since the very beginning of the school, but now through the PAN, that opportunity is opened up to more members of the public to have that experience. And they will be participating in the strategy group and the operational group. So the opportunity for members of the public to get involved in decision-making across the school, they're now opening up, and they're going to be making a very important, it's early days, but their contribution has already been really valuable and insightful comments. And then the third and final subgroup that's been set up by the PAN is most recently an evaluation subgroup. We're just entering, as I say, the last year of this second 5 years of the school. And so evaluating the process of involvement and the different models that we have and the impact is going to be a priority for this last year. And public partners on the PAN are going to be actively involved in that as peer researchers as well as advisors. So just a few other highlights of what we've been doing. So the operational group has been reviewing the diversity of public involvement across the school. As I say, we've got lots of different models and different approaches. And so they're looking for examples of good practice, but also for areas which are more challenging so that we can develop ways of supporting people. We've been setting up training opportunities for members of the public and for academics. And one highlight there was a collaborative training with the other 2 NIHR schools for primary care and for social care, where public partners in the 3 schools came together to share their experiences. And that was considered to be very successful, very valuable. We'll do more of that. We're also looking at producing a coherent policy on rewards and incentives for public partners. As I said, the school is 8 academic members, and that's more than 8 universities because some of those members are collaborations. So each of those universities in the school has its own policies and practices around public involvement, what fees they pay, how they pay them, what training they provide. So we have the risk of inconsistency across our members. So we're looking at all those policies and going to pull together a single policy for the school, for research that is funded and supported through the school. And that's going to be really important. And then a third area that we've got involved in with NIHR and other colleagues, other agencies, is to begin to think about a dedicated guidance for public involvement in public health research, population level research. there's a lot of guidance out there, we know there is, but we won't be duplicating that. We'll just be looking to see whether there are some gaps from the perspective of public health research. So that's just some highlights of what we've been doing. If you want to know more, you can download the strategy from the website. You can go to the website. You can get involved. Please do if you're interested, or if you want more information, get in touch. So thanks very much for listening to me. I'd like to take this opportunity to thank all the members of the public that are involved in the school, making an invaluable contribution to the work we do, and to the people who are contributing their time to the strategy group and the operational group. And of course, to everybody who's making public involvement work effectively across the school. Thanks very much.